Hey, it's Bram Duffee. Welcome back to Health Communication class. Today we're talking about health campaigns and interventions. Health campaigns and interventions are two strategies that aim to educate individuals and encourage positive behavior change. While they share a common goal, their methods differ. Like community-based and school-based interventions actively step into the lives of the target audience, while campaigns that are just communicative would rely on persuasive messaging. So let's start with just talking about mass media campaigns. Our daily media consumption often includes messages promoting healthy behaviors and discouraging unhealthy ones. For example, you may have heard radio spots about emergency preparedness or sustainable food sourcing. Public service announcements or billboards are also platforms for these kinds of campaigns and work to reach out to a broad audience. And so let's discuss some of the theories and models that might guide these campaigns. The first one to mention is the trans-theoretical model, or the TTM. The trans-theoretical model helps identify where the target audience stands in their journey towards a specific health behavior change. So this enables campaign designers to tailor messages to different audiences at different stages of the change. And so the theoretical model is a roadmap for health behavior change and also can work towards helping promote things like regular exercise. To do that, they might tailor their message to folks that have a sedentary lifestyle and showing the negative impacts of that. The campaign could highlight the benefits of exercise. So for individuals in the action stage already incorporating exercise into their routine, the campaign might provide tips in maintaining this healthy habit. Or another example of the trans-theoretical model in action would be like the smoking cessation campaign. This campaign would tailor its messages based on the different stages of change that individuals experience when trying to quit smoking. For those in like a pre-contemplation stage, those folks that might not recognize the health risks associated with smoking, the campaign could just focus on raising awareness about the dangers of smoking or the benefits of quitting. For individuals who are in the actual contemplation stage, who are considering quitting but haven't made a commitment yet, there could be a campaign message that would offer motivational stories about resources that would help people better weigh pros and cons. And for maybe some people that are in the preparation stage or the maintenance stage, there would be a different kind of message to hit them. And so I think right now about political campaigns as well, about how if you are trying to reach out to someone at a particular time with a particular message for that maximum impact, we have to design maybe messages that would attach themselves to all types of the people on the decision spectrum. Another theory model to talk about is called extended parallel process model. And the extended parallel process model is really important in designing fear appeals. What happens is that it gauges the likelihood of an individual performing a behavior to avoid a potential threat. So that kind of model helps design fear appeals, which are messages that scare people and to motivate behavior change. And so let's consider an example using this extended parallel process model when we think about cybersecurity kinds of awareness. If we use that model, we could say, hey, the campaign might design fear appeals that highlight the severe consequences of cyber attacks, like identity theft or financial loss. And they can do that by showing real-life stories of individuals who suffer due to bad passwords or unsecure networks. And then the campaign would provide clear, actionable steps to enhance online security, such as using complex passwords and enabling two-factor authentication. All that kind of stuff helps empower individuals to take protective measures and to reduce their vulnerability to cyber attacks, right? So now let's apply the extended parallel process model to public health campaigns, because public health campaigns that are out there promoting vaccinations, in this scenario, the campaign could use fear appeals to emphasize the serious health risks associated with not being vaccinated, like contracting and spreading preventable diseases like measles or the flu. And so this campaign might include testimonials from individuals who suffered severe complications due to those diseases. And it could highlight the potential consequences of remaining unvaccinated. And so to balance the fear appeal, the campaign would also provide clear information on the safety and effectiveness of vaccines. And all that along with easy steps to get vaccinated, like a location nearby and incentives or ways of easily scheduling appointments. So this approach aims to motivate individuals to get vaccinated by addressing both the threat and the efficiency of the recommended action. And so in all of those kinds of examples, we can think about how extended parallel process can take effect and help, because we are doing some balancing of fear appeals with fear, but giving support, and information that's serious, but that leads you to get what you need. The other theory that I wanted to mention was called the elaboration likelihood model, the ELM. The elaboration likelihood model looks at how people process messages, considering factors such as ability, the person's motivation, maybe how good they are at responding. So the elaboration likelihood model explores how people process persuasive messages. A campaign promoting healthy eating could use the model by providing nutrition information, or for those motivated and able to process information, maybe simple slogans or appealing messages. For those individuals who are motivated and able to process the detailed information, they might provide detailed statistics, that help support them. So this elaboration likelihood model is one that explores how people process persuasive messages so that they can attach to them in a way that would be effective. So for those who are maybe less motivated or able to engage with detailed information, the campaign might just use catchy slogans or eye-catching visuals or some kind of endorsement from a popular influencer. But the use of both routes, this giving positive associations and also using a strong appeal, these kinds of things can work to reach a broader audience and encourage more people to adapt and adopt new behaviors. So the elaboration likelihood model is pretty extensively studied, and so I wanted to also mention the health belief model, because the health belief model is something that predicts action taken to prevent or to screen for or to control illness, makes a difference. And so, like, for example, a skin cancer prevention intervention could use the health belief model by emphasizing the severity of skin cancer, the individual's susceptibility, and the benefits of prevention methods like using sunscreen and wearing hats. So when we think about campaigns that would involve the health belief model, it takes into account the person in multiple aspects. And so we can think about, if we take a person that has pre-existing health beliefs, then those are things that are going to be influencing behavior. Also, the way that we see things fall in our everyday lives, we're constantly bombarded with a multitude of messages. A lot of times, those messages are carefully crafted using psychological and communication theories. And that's why we go through and talk about, gosh, how could this message be packaged? And what would the intent of that message be, and how would it get there? So these messages are often part of larger health campaigns or interventions. And so it's not just enough to understand marketing or advertising. It's important for us as consumers to be able to critically analyze messages so that we understand some of the theoretical underpinnings that drive them. And so while these models can be used to our benefit, promoting healthier behaviors and choices are important enough that we are in a position to make sure that we are not manipulated, especially when we look at enhanced marketing tools like AI. And so this is something that really highlights the importance of being informed on your own as a consumer and understand not just the content of the messages that we receive, but also the underlying strategies and theories at play. And so by doing so, we can make more informed decisions and navigate the world of media and communication more effectively. When we think about things like the elaboration likelihood model and the health belief model and the trans-theoretical model, these are all influences that help messages be crafted and campaigns activated.